Hey, Denise.
Hi. Well, just to say that was great. It was
Oh,
thank you
good.
so much. All right.
Good,
But
good.
I'm gonna ask about a friend that's really struggling. All right.
Okay.
I think she's 78 now.
Okay.
She's down to bone on her hip. She is due to have a
Yeah.
hip replacement in March. She cannot
Yeah.
walk without the cane.
Yeah.
She got a puppy kind of I think because her heart was really needing that, but it's a
Yeah.
Boston Terrier and it's hard for her to, you know, get the dog out and, move around. But she's at least the hip's gonna, but a tree came down in the backyard and it took out part of the fence with this snow and ice we had. So she says, I just can't take anymore. And Greg, she had a long kind of cold flu, something deep in that she just had horrible digestive. I didn't know her at that point, but she
Right.
went through it a long, long time. But she just came out of that and went into all this. What could I get her to kind of, get her a little bit more calm and a little more maybe ready to get her more dialed in for that hip replacement? She is going to have some help, and I think she can almost transition home fairly quickly, is my understanding.
Okay. And how long has it been bone on bone?
I think it has been a while. But,
Yeah, quite a while.
because I watched her move, but it quickly went from that, Greg, to where she just can't walk without a cane at
Yeah.
all,
Yeah.
and maybe a
It's been there
walker.
a while.
But
It's
yeah.
been there a while. So, I mean, the thing with when it's bone on bone, a lot of times, like if you have an injury, like the idea or the rule of thumb is like move it, keep it moving, keep it strong. But here, every time those bones rub together, you're generating inflammatory material.
Uh,
Like, I mean, it's basically the more she can rest, sometimes it feels or seems a little counter intuitive, but the more that she can rest, you know, the better. The issue is that there's inflammation and there's really poor lymphatic movement in the area. And so what happens is that inflammatory material at some point is just localized in that hip area, but at some point, if the lymph isn't moved out of that area, it becomes systemic. Like it just
mhm.
starts to spread all over the body. And that she's walking with a cane, I would definitely encourage her to walk with a cane. Um, you know, I know the dog was like
Yeah.
for the heart, but it's really hard on the hip. Like, 'cause
Yeah.
she's gonna have to be careful walking for a few weeks and somebody's gonna have to probably give her help with the dog a little bit. And so lymphatic work, a lot of times with a hip where it's a bone on bone, we use joint relief just to keep blood moving, reduce the spasms, get some lymph moving. Um, in the old days, like going back in like the 1800s and stuff, bone on bone hips were a lot actually more common because for one, they didn't diagnose dysplasia, which is like just a weird sized, like the head of the femur, your thigh bone fitting in there. They didn't really diagnose it. They didn't have the ability to. And so uh, there was that issue, but it was also the riding horses being thrown from the horse, riding, a stagecoach or something being bounced around all the time. And so there was a lot more cases of like bone on bone and of the hip. And, it can cause you to be much more susceptible to getting sick and having infectious conditions like the flus and colds and things like that. And so she's got something close coming where she's having the hip replacement and that will bring her a lot of relief. But until then, joint relief could be good just because it's kind of a pain reliever, gets blood to the area, reduces spasms, generates some lymphatic movement. But the reason why I was talking about the 1800s, and they didn't have medications and they didn't have a surgery for this. Like a lot of times people would just end up being bedridden with
Oh,
this. But one of the things that they would use is there's an herb rather than a essential oil. There's an herb called blue flag, and we have it on the site.
you do.
And yeah, and it's it's not a spadgery or anything. It's just a straightforward herb. And the thing with blue flag is it's one of the best things for stimulating like lymphatic movement or lymphatic circulation. The idea in the old writings would say like if you take blue flag, there tends to be spontaneous lymphatic movement where when you're dealing with something bone on bone, the lymph gets really stagnant in that area, and so it keeps making the lymph move in that area. And it's not going to be a magic bullet, but it will probably make her a lot more comfortable.
Okay.
And then the other thing that I would say, it depends on how much you're wanting to do or how much she's willing to do or whatever. But anything to help sleep, like with the hip being that it is, every time she lays down, she's probably in more pain when she lays down than when she's up and about because she doesn't have the distraction of doing everything. And then, you lay down and you're like, okay, now I'm being aware of my body and oh my God, my hip hurts, you know, and the quality of sleep is probably has gone down. And, it's very common for people with a condition like this or an injury that when they lay down, they almost develop a phobia because for one, they don't feel better when they lay down to rest, because they're more aware of the pain. And then they don't sleep very well. So then they're going to be frustrated that they're not sleeping. And so what happens over a period of time, they develop a phobia. And so
Okay.
anything that you can do, like, in the oils that you have handy, spikenard, marjoram, lavender, vetiver, anything that you can get her to inhale that could calm the body, calm the system, especially at night, so that she can get some rest. You know.
Um, on the joint relief, would that be a body tonic or is that a straight up oil?
You
How
could
would,
do a body tonic, but if I had my first choice, it would be an ointment form. And the
okay.
reason to do it in an ointment is that when you put it in, like with that, I think it's in like a herbal extract of sesame with like a licorice root, which has like a little bit of a steroid effect. Um, the sesame oil or the massage oil or whatever it is will hold more of the essential oil in that specific area rather than just scattering it through the body. And that it's almost like doing a time released treatment in a particular area when it's in like a base of an oil, where a body tonic, it hits the body and kind of goes everywhere. It goes deep, but it hits the bloodstream and it starts going other places. And so I would treat it with an ointment.
That's
The
great.
the
I
other
can tell
thing
you.
that you might want to think about that might be helpful for her is galbanum will help reduce the pain.
Okay.
Just like a few drops internally, a few drops on the wrist. And Sylvester Pine will elevate cortisone levels in her body. Like it doesn't contain cortisone, but it stimulates the body's production of cortisone, which will act as an internal anti-inflammatory or have a bit of a steroidal effect. And again, it's not going to be a magic bullet, but it can make life a lot more bearable until the time of the surgery. And then when the surgery happens, after the wound starts to close, putting things on there that are anti-inflammatory and helichrysum on the scar, things like that will cut down the amount of physical therapy that you'll need.
This is great.
Yeah.
On the Sylvester Pine,
Mhm.
how would she take that?
Just two or three drops on the wrist. Like with her being in the place that she's at, I'd probably do 4 or 5 on the wrist.
Okay.
Yeah.
I do know that, well, at least when I saw her around Christmas time, she was saying that whatever magnesium she's really taking for, because she's
Mhm.
realized she's at Bone and Bone. This is still newer revelation on some of this stuff. She said
Mhm.
it was really helping her sleep. I don't know
Oh,
where she's
good.
at really to per
Yeah.
se today, but
Yeah.
I think she's fried. She says, I can't take much
Yeah.
more for when she
Yeah.
wrote to me today. So I knew that I was going to try to ask.
By the time they're starting to have to like walk with a cane or not do as much activity, there's usually a lot of pain, like a lot of pain, a lot of inflammation. And, any time that the body is in pain or like here a joint's compromised like that, I mean, part of why sleep is also hard is it throws the body into a fight flight response. It's the pain is trying to get like the attention of like, hey, we have a problem here. And the problem's already causing issues, but the pain makes it worse. And so, yeah.
I thank you. I'll give her a call this evening and go over some of
Okay.
it with her. And I'm
Sure,
hoping
sure.
it gives her some hope and, start building her up a little bit for this surgery, and
How
coming in.
far away is the surgery? Do you know?
I kind of think it's mid-March because even when she told
Okay,
me in
so like a
December,
month. Yeah, like
yeah,
a
I'd
month.
say about a month. I mean, she's
Okay.
getting close and she's got to figure out that dog and who's coming
Right.
in. And yeah, and
So,
she was hoping to move Greg on top of this
yeah.
over to, and I'm like, are you serious?
So this
She,
is the other thing that I would say is, depending on if they go through the front or the side or the back, like the front, they'll still have the most mobility. But, different surgeons do different things, and some of the devices last longer depending on like how they do it. And, but I would tell her over this next month, spend time raising everything up so she doesn't have to bend over for it. So
oh,
that for that 3 or 4 weeks of her, post surgery, that she's not having to bend a lot, so it makes it easy that she can just grab things and, those long grabbers, you know,
yeah.
scatter them through the house. Like just so like, maybe you can't reach a cup or something out of the cabinet, but you got the grabber, because she's not going to have the mobility for a little while. And that galvanum is going to be really helpful post surgery because usually the second week is harder than the first week.
Okay.
And then the other thing is, you know how like when you go to like Lowe's or like one of the hardware stores like Home Depot or something like that, they have those little aprons that like guys can put like nails and staple gun and like all those things. Tell her to get one of those and keep her phone, a tablet, a pen, her meds, like, have the things that are necessities like on her waist so that she doesn't have to get up and move all the time. It's only for a few weeks, but it will make life a lot more comfortable.
Oh, this is great. No, I'm taking notes like crazy. So
Yeah.
no, thank you so
You're
much.
so welcome.
You really dialed her in well. Thank you.
You're so welcome.